As of today, the statewide mask mandate has been lifted. While the state moves forward without masks being a requirement, local health authorities have expressed their concerns. KMR Local 4's Ali Cassetti reports.
10th marking day one of masks being optional in the state of Texas.
I will admit that I am in the camp that is rather nervous about this transition.
Northwest Texas Hospital's Chief Medical Officer Dr. Brian Weiss saying this scenario isn't very dissimilar to his occasional patients who are taking medications for hypertension.
And they come in and say, you know, doc, my blood pressure has been looking great recently, so I went ahead and stopped my blood pressure medicines. It's usually no surprise that their blood pressure surges after that.
Dr. Wise later addressing commentary about another expected surge in COVID-19 cases, explaining that in all the commentaries, the common theme has been the UK COVID-19 variant B.1.1.7.
What they've been able to see that in communities where this particular variant is, there's a tipping point when it hits about 50% of the prevalence of the virus in that community, meaning that half of the virus is this variant.
And when that happens, those communities see surges, with the UK variant being 75% more infectious.
Right now, there are parts of the United States where we are at 40% of prevalence of this particular variant. So, you know, most of these commentators are saying within the next 1 to 4 months, we may be to expect basically a surge based on the prevalence of this variant.
Dr. Wise continuing that as we let our guard down, we also must be prepared to put it back up quickly if this turns out to be the case here in the United States. BSA's Chief Medical Officer Dr. Michael Lamentier adding that he urges everyone who is eligible to receive the vaccine to go get it.
I think that the safety and efficacy at this point certainly is pointing in the right direction. And we're never going to know all details about any drug or therapy. There's going to be no drug or therapy that has zero risk.
Now, additionally, both Dr. Lamentier and Dr. Wise restated that both BSA and Northwest Texas Hospital will be requiring visitors and employees to continue wearing masks within their healthcare facilities. In studio, Ali Cassetti, KMR Local 4 News. Andy.
Ali, thank you. Dr. Wise asked for everyone to continue to do these safety measures as much as we can, and that the more we can do in our community, at least for the next few months, the better off we're going to be for hopefully avoiding any future resurgence.